I'm going to call to order the Edina Community Health Committee special meeting, December 2nd, 2013. Can I have the roll call, please?
Member Bothan Hurley. Here. Member Kingston. Here. Member Pence. Here. Member Stegner. Here. Member Johnson. Here. Member Martin. Here. Member Connor. Here. Student Member Edina.
Here.
Student Member Meadell.
Here.
Chair Doskotch.
Here. I'm going to move to item number 3, approval of the meeting agenda. Is there any additions or changes? Move approval.
Second.
So we have Member Stegner with the motion to approve and Member Hurley with the second. All those in favor?
Aye.
Anybody opposed? Motion passes. Next agenda item is approval of the November minutes. Are there any additions or corrections? Can I have a motion to approve the November minutes?
Second.
So we have a motion by Member Kingston and a second by Member Martin. All those in favor?
Aye.
Opposed? Motion passes. Item 5, reports and recommendations. So first off, I'm going to talk about Bloomington Public Health and our recommendation for renewal from our, this is a little bit of a review from our prior month's meeting. And what we did was at our November meeting, talked about the services that Bloomington Public Health provides to the city of Edina, highlighting their willingness. I'd also like to highlight their willingness to work with us in 2014 to further address specific needs of the Edina community that will come up in our later discussion tonight. But of those things at Bloomington Public Health and to push a little bit of awareness out in the community of the things that Bloomington Public Health does for Edina, I just wanted to quickly review some of those things that are in their 2012 annual report. The programs and services that are provided by Bloomington Public Health to the city of Edina and its residents include clinical services, health promotion, disease prevention and control, emergency preparedness, family health, and vulnerable adults and senior programs. And within those particular areas, there are some very specific services that are provided, and I'll just highlight some of those as well, just so there's more awareness in the community of those things. First, in the clinical services side, Bloomington Public Health offers Edina residents breast and cervical cancer screenings, cardiovascular screenings, and health risk assessments. They also provide women, infant, and children WIC nutrition program needs, education, and works with them on food vouchers for low-income pregnant and breastfeeding women, infants, and children up to age 5. With regard to that, in 2012, just a couple of statistics that are worth mentioning. In the WIC program, there were 360 clients with 2,500, a little over 2,500 visits. There were 44 breast and cervical cancer screenings completed by Bloomington Public Health. In the health promotion side, Bloomington Public Health is responsible for working to create environments that promote healthy choices for youth and the community in general. Main goals are reduce health risks such as smoking and obesity, which is a focus of this group, as will be discussed, and increasing access to healthy behaviors. With regard to that, in 2012, and realizing we're at the end of 2013, but in 2012, there were classes and outreach that went to 394 students. There were educational presentations on issues related to alcohol, tobacco, other drugs, and laws involving youth to 635 attendees. With regard to disease and prevention control, Bloomington Public Health seeks to reduce risk factors and burdens of preventable and communicable diseases. One item to mention is that they provided influenza, immunization or seasonal flu shots to 662 Edina residents. With regard to emergency preparedness, Bloomington Public Health works to improve the city's capability for responding to any health emergency and increase community preparedness. With regard to that, one item that they did participate or facilitate was conducting emergency preparedness workshops for 6 community-based organizations and 30, with the attendance from 30 people from faith-based organizations in our community. We're in the communities of Bloomington, Edina, and Richfield. With regard to family health programs, Bloomington Public Health seeks to address health concerns and needs of infants, children, adolescents, mothers, and families. There was intensive public health nurse home visits to 14 clients and 187 visits as an item to look at. And with regard to that, they visit new parents for high-risk pregnancy, postpartum, and newborn care. With regard to vulnerable adults and senior programs, which is of importance to the city of Edina given our demographics, Bloomington Public Health strives to improve the health status of seniors and reduce risk factors for vulnerable adults. With regard to that, there were 180 clients that had participated in the program Talk with a Nurse, which are clinics held at community locations to provide one-on-one consultation with a public health nurse. So 180 clients and 454 visits. There were high-risk home assessments were conducted by Bloomington Public Health, where public health nurses assess physical, psychosocial, and environmental risk factors and provide referrals, consultation, education, and advocacy for vulnerable seniors. There are 53 clients with 77 total visits. That's just a snapshot of some of the things that Bloomington Public Health provides to the city of Edina. We, as a community health committee, at our last meeting, did pass a motion that recommends that the city, again, once renew its contract with Bloomington Public Health for the upcoming year. Now that I've gone through all that, one of the things we also did at that meeting was discuss what our top 10 health priorities at our last meeting and communicated to Bloomington Public Health were the top 10 health priorities for the city of Edina. And that came about through Bloomington Public Health first facilitating a workshop with both Bloomington, Edina, and Richfield where we discussed critical data and information related to the health of the community. And as a result of that meeting, in addition, I would say a lot of very critical analysis, discussion, and work by this committee, we were able to prioritize a list of top 10 health focus areas for the city of Edina going forward. And those are, first, nutrition, obesity, and physical activity. Number 2, aging of the population. 3, alcohol, tobacco, drug use, and abuse. 4, social and emotional well-being. 5, mental illness. 6, unintentional injury. 7, intentional injury prevention. 8, maternal and child health. 9, immunization and infectious disease prevention, and 10, one that really covers a lot of things, healthcare access. A couple things to point out about this list is that nutrition, obesity, physical activity, alcohol, tobacco, drug use and abuse, and mental illness are all identified as priority items by the Hennepin County Community Health Improvement Plan, or the CHIP plan. Additionally, with regard to Bloomington Public Health, the items of aging of the population and social and emotional well-being and maternal and child health were also identified as priority items. So all those have found their way onto our list. I think the overall factors related to nutrition, obesity, and physical activity, one, obesity now being identified as a disease, and a particularized focus, I think, throughout actually the country, let alone the state of Minnesota, ended up at the top of the list. And obviously, aging of the population, given our demographics, is at the top of the list as well. Some of those items will be discussed later on the agenda. Is there any other comment from any of the other committee members on that list, or any of the information I just went over related to Bloomington Public Health before I move on. Okay. The next item is item 5C, SHIP funding and priorities, and Member Pence is going to have a short discussion about that.
Thank you. Just an overview for those who are unaware about the SHIP program. The SHIP stands for Statewide Health Improvement Program, and a little historical background. This program was created under Tim Pawlenty's administration probably about 10 years ago, and it was designed to really work on health promotion and disease prevention as part of healthcare and public health. And it is now in its third rendition. The funding was cut slightly in the second version of SHIP, which is now being called SHIP 2. So now we're into SHIP 3. The funding was almost entirely restored in the last legislative session. And so the funding for this program comes from the state government, and it goes directly to the local public health authorities. So in Hennepin County, we actually have 3 public health authorities. We have the Hennepin County Public Health Department, the Bloomington, Edina, Richfield Public Health Department, which serves our city, and then Minneapolis has its own health department as well. So for Hennepin County, essentially 3 different agencies received funding to work on SHIP. And so working with the Bloomington Public Health folks, they have actually been awarded $885,000 for the next grant period for their SHIP 3 work. 86 of the public health authorities in the state of the 87 that could have applied for the dollars. And so they kind of essentially took the dollars, split them up based on need, based on criteria that they put out and plans that this health department submitted. So Bloomington submitted their plan. The grant period started on November 1st. It was originally supposed to run through the end of June of 2015, so it was supposed to be a 20-month grant period, but the state has extended it till the end of the biennium, so October 31st of 2015. So it's actually a 24-month grant period now. So each of the agencies was given a little bit more money than they had asked for. And so there are 8 different priorities that each of the public health authorities are required to work under. And so for Bloomington Public Health, the first one, community healthy food environment. Their intent with these dollars, and I'll just kind of run through, they've submitted a lengthy list to the state, and we're funded for it. But primarily it's to look at community food assessment work that they started in SHIP 2 and are now carrying over into SHIP 3. They want to continue to assist cities with the implementation of healthy concession policies. That's something that they had started in Edina, they started in Richfield. They really want to kind of expand the work that they've done. They were doing some piloting before, and now they really want to expand it to include other recreational facilities. They also want to help facilitate the adoption of city nutrition policies and support implementation of policies through training and resources. And I think this pairs well with our health and all policies work that we have passed forward to the city council. They have other pieces with community healthy food, but those are kind of the main pieces, especially the ones that would affect Edina. The community physical activity, active transportation piece is a big one as part of Bloomington's SHIP 3 work. They want to establish and formalize active living work groups in each city. And so I would imagine we will hear more about that as they get the money and start to implement this program. They also want to implement annual bike and pedestrian counts so that cities know exactly who's using their facilities, who's walking, who's biking, how are they being used, how are they not being used. So I think those are 2 pieces that will be interesting to us as well. The third and fourth options are really focused on schools. There's a healthy school food option, and then there's an active school day. Priorities, they want to work with the school districts to reconvene the healthy food committees that they had going. The city of Edina does have a district, or the Edina Public Schools does have a district wellness committee going, and so I think the intent with SHIP 3 is to support the work of that committee that's already active. They want to create garden lesson resource guides. A number of the schools in Edina especially are working on creating community gardens, and so the city wants to help create some best practices and things like that so that it make it easier for additional schools to add it. They also want to work on some district-wide farm-to-school programs. Might be trickier in Edina than some of the others just because we outsource the food service in the city, in our school districts. So, but I'm sure that there's going to be a discussion with that as well. One of the new pieces that they're required to work on this year is actually working with communities and clinics. They're not sure quite how they're going to do that yet. They haven't specifically identified any clinics in Edina they want to target or that they're going to work with. That may change, I would imagine, over the next 2 years. We'll see, especially as clinics are being asked to do more community-based work as well. They are going to continue working with childcare centers to help childcare centers, especially family daycare centers, implement healthy food practices. There's a lot of family childcare that happens in the Bloomington, Edina, Richfield area, and so they really want to work with those childcare centers to make sure that they have healthy food policies and practices. They're going to continue working on worksite wellness, doing outreach to area work sites, probably as sites that used to be part of the Do Town campaign will probably be keyed into first of all. And then they want to partner with organizations that are already doing community health work. So Fairview Southdale Hospital has their community health needs assessment, which they put out in 2012. And so Bloomington and Richfield wants to partner with them as well. And they're also going to participate in the newly created Center for Community Health, which is actually the meeting I just came from. So there's lots of plans in the works. They have a lot of staff assigned to this, so I think we'll see a lot of interesting pieces coming from the SHIP program because they're now back at essentially full funding. So it'll be nice to have a lot more resources towards this work.
Are there any questions for Member Pence?
I have one. I was wondering what they have identified for measurement of how well they're doing with the things that they're setting out for themselves.
They have not shared what their measures are yet. So they've just literally had one meeting of the community leadership team at this point. So I would imagine because they just learned about the funding about 2.5 weeks ago. So now they're kind of in fast and furiously getting the program up and running because, of course, the funding arrived the day after they heard that they were going to get it. So as I would imagine we will hear within the next couple of months what their plans are. Any other questions?
Is there any venue for cities to have any type of input as far as the types of outcomes that we'd like to hear about or that we'd like to have from them?
I would imagine they would be more than willing to listen to our requests. I sit on the community leadership team, so I'd be happy to take any requests directly to the team. I think also we could contact Karen Zelsnick and let her know what our desires are, and I'm sure she could help us get into the program as well.
Perfect, thank you.
Sure.
One more comment. In the quality of life survey, we asked about bike ridership and walking in the community. So we actually, for some things that they mentioned, I think we may already have some data, local data that would be of interest to them.
And I think the transportation system within Edina is fairly mature as well, so I think we probably have some good data already that some of the other cities do not. But I think the counting is going to be part of their kind of goal to systemize a lot of the work that has been happening in some of their cities.
Thank you.
Sure.
If there are no other comments or questions, I'll move on to the next agenda item, which is review of the draft report and recommendations, which is the lovely 47-page document that I sent or Laureen sent to you. And so just a couple of comments. This is a document that's actually been around for a little bit of time. I think it required additional work, which has now been done by this committee over the last, I would say, 6 months to help try to finalize it and finish it out. It also includes the updated data that Member Stegner put together today and commentary related to the quality of life survey from 2013 and then comparing common questions to the 2011 survey. And so I think you'll talk a little bit about that in a couple sections from now. But with regard to the report, there were a couple gap areas that I actually, I think are updated now and have updated related to the SHIP information that I pulled off essentially from the Bloomington Public Health website to fill in that gap. I also filled in the school health assessment section, which talked about the data from the prior school year It only had 2010, 2011, or what have you. Anyway, it was a year off. I've now updated it with the information, the most recent information from the school nurse in the public health system and the school system. So that's in there. Another item that has come up recently that we may want to consider and have some discussion about briefly here, but at least identifies an area of potential review, and it came up at our last meeting, was the electronic cigarettes issue. And I think it's maybe an area that we identify for further study in this report. Does anybody have any comment on that or want to have a further discussion on that point before I add? I intend on adding it in, but I wanted to get your input before I did that.
I believe I read the high school added electric cigarettes to their no tobacco on campus policy recently. And I read somewhere else, I think, that the city council is talking about what to do with it shortly.
Okay.
But I don't know any more than that.
Okay.
Well, I would agree from a health standpoint that it certainly bears watching and analyzing. There's a lot that we don't know yet as far as the long-term effects of e-cigarettes, and I think it's certainly worth adding to the report.
Any other comment or thoughts?
I recently also heard that the school survey results for Edina are going to be out shortly. So when they become available, if it's before the end of the year, those could be added.
Thanks. All right, so I intend on adding a section that requires, or not requires, but discusses a focus or further analysis of electronic cigarettes in 2014. And I think that will fit under an item on our work plan, or we have some ability or flexibility, and we'll talk about that. I'll talk about the work plan at the end of the reports and recommendations section, but we have some ability to fit that in as an area of focus for next year. The only other data point that isn't in there is there was prior data that was pulled from 2010 related to the Edina Fire Department and their emergency services and what they end up focusing on. I will work to try to get the most updated data on that. I suspect it's not particularly different, but I'd like to confirm that and add that to the report, so I plan on doing that before the end of the year. I don't suspect anybody got through the entirety of that report before this meeting and reviewing it. So my intention would be to continue to receive any input on it and revisions. It's actually more charts and graphs than anything else, to be honest with you. There's not a lot of text. If you can get me your comments by the 15th of December, it'd be much appreciated. And then my intention would be to provide this report to the City Council, barring somebody having a major objection to doing so between now and then, the end of the year, providing it to them as a good background of kind of the state of health in the community in Edina. And to that end, I think one of the key highlights, and we'll get into some gaps and some areas of focus in a little bit, but I think, the conclusion of this report, again, there may be some slight modification, but that currently the health programs and services adequately meet the community's overall health needs. There are some gap areas. There are socioeconomic factors, and including income and education, that tend to make Edina a healthier community relative to Hennepin County, relative to Bloomington and Richfield, but yet there are still work to be done. That's sort of the general conclusion or the analysis of the report. And I think the further point is that, if we have appropriate program services, infrastructure changes, and education, we can further enhance the health of the community. And so that's the general position of the report. Is there any comment on that? Hearing no disagreement with that, that's a good. It seems like we're all relatively on the same page with regard to that. And so I will continue to work to get this completed by the end of the year, and look forward to your further input. And be sure to provide that input just directly, well, either through Lorene, it'd have to be through Lorene, then to me. Let me ask this, is there any other areas of focus that anybody knows of that aren't in the report at this point that need to be? You may point them out to me in the next couple weeks, but I think I covered everything there possibly could be. Okay. The next section is on the status of our city mission, vision, and code modifications and recommendations. And sort of for the audience out there, November 4th, officially, our prior advisory communication about a proposed mission, vision, and city code revision went to the city council. That was the official date. It went to them. We're still waiting for comment. I'm actually planning on it, or will be attending, assuming it stays on the agenda, the December 17th meeting, and discussing this document with the city council. And the action requested in the advisory communication, just to refresh everybody's recollection, was that the city council consider and adopt proposed changes to the city of Edina mission and vision in the city code 1503. With regard to the change to the city code, the general premise was that there's a Minnesota statute, 145A10, which sets forth a number of duties that are required by public health boards and entities advising public health boards, and that we would adopt those duties. And with regard to that, what it would say is determining the mechanisms to address Edina public health priorities, the Community Health Committee shall study and advise the Community Health Board on a series of issues, which a couple of which would be monitoring health status to identify community health problems, which we've discussed already in this meeting, developing policies and plans that support individual and community health efforts, which will be a focus of this committee as well. And so the intention is to have that considered for adoption and change, and I'll discuss that with the City Council at the December 17th meeting, if it stays on the agenda. Then the second thing was we as a committee evaluated whether a modification to the city's mission and vision statements was in order in view of a couple of things. One, factoring in health in all policies, looking to whether adopting health in all policies was a good position for the city. I think we do believe that as a committee, and in doing so made some proposed changes to the mission statement of the city of Edina that looks to focus more on health-related issues, not the least of which would be promoting the physical, mental, and social well-being of those that live and work in the city of Edina. And I'm paraphrasing a little bit. And then weaving into the vision statement of the city, health-related concepts. And so, for instance, there's one that talks about innovation, and innovation means cooperation, and this is the addition, means cooperation and collaboration between local residents, businesses, schools, healthcare providers, and community leaders to create a more healthy, safe, and vibrant community while improving the quality of life of all that live and work in Edina. I like that. And so those proposals are, again, with the City Council. I will meet with them on December 17th. But I wanted to provide you that update because that will help us then move forward for the next year. And again, there may be a bifurcation of the ordinance issue versus the mission and vision, which may require further discussion in 2014 with the broader community, because as this, I think, committee would recognize, interestingly, the ordinance is a less of a change rather than the mission and vision of the city, I think is a more significant change. So, is there any question or comment on that? And then I'll stop talking for a little while. Okay, great. So the next agenda item is 5F, which is the Youth, Senior, and General Health Subgroup reports. And just for the audience sake, what we decided to do as a committee, probably at the beginning of this year, was to create subgroups that focused on 3 areas: youth, seniors, and general health of the community, to provide an ability to get additional, more focused work and analysis done by smaller portions of this committee, and then provide recommendations to the broader group on those particular areas. And so we've done that work, and a lot of that work is in the report. A lot of that work is in the work plan for next year. So just briefly, I'm going to work through each of those areas, and would like one of the members of the subgroup to then report out particular gaps or issues that we're seeing, and potential solutions and things that we might be working on in 2014 related to those issues. So I'll go to the youth subgroup first, and Member Martin.
Thanks, Matt. So for the youth subgroup, this covered a pretty broad range of ages, from 0 infants all the way up through, I think, 18 is what we identified as the youth. And I'd like to focus on 2 gap areas. As Matt said earlier, overall, the health of the youth in Edina is very strong, and what the city is doing to serve the youth in Edina's health needs is very good. But we did find 2 gap areas that I'd like to talk about. This data all came from the 2010 Minnesota Student Survey. As Member Stegner indicated, we are anxiously awaiting the 2013 data, and that may change some of our recommendations depending on what that data says, and that will certainly go into our 2014 work plan. And the first one I want to talk about is alcohol, tobacco, and drug use, and this is what identified as one of the top 10 health priorities. But what was interesting to us was actually a change in the percentage of youth using alcohol, drugs, and tobacco between the age of being in 9th grade and being in 12th grade. Those are 2 data points that the 2010 student survey looks at. And with both tobacco and alcohol, there was a significant rise in the use of tobacco and alcohol between those age groups. For tobacco, it went from somewhere around 4% in 9th grade to about 21% by 12th grade. And for alcohol, which is actually the survey is defined as binge drinking, that goes from about 4% to about 40%, actually over 40% by 12th grade. So based on those statistics, we believe that there's some work to be done in this area, and it's actually kind of a unique area because this data comes from the student survey, which of course is partially done through the school district. We also have the city, and we have our Tri-City partners. So we believe this is an area that we can actually work between a lot of different organizations to get some education and hopefully some change, and that's part of our 2014 work plan. So that would involve working with the Edina Chemical Health Coordinator in the school districts, working with the city, and then again with the other local organizations to reach out to youth who might be experiencing this rise in tobacco and alcohol use. The second gap area that we identified has to do with bullying, which both in our state and in our city and in our country has kind of risen to a level of significance among youth. And again, the statistics in Edina are at or near the Minnesota state levels of bullying, but we do believe there's work to be done here. And so we again think this is an area we can potentially collaborate with the school district, because we know school district has some programs addressing bullying, but we would like to, of course, participate and be of as much help as we can be as well. to reduce the scope of bullying, of course, we would want it to be 0% if possible. So those are just two little gap areas we identified for the youth subgroup. I don't know if anybody has any questions or comments about those.
I just think one thing that should be added is the Tri-City Partners Chemical Health Partners group that used to be active in Edina has gone away
Okay.
because that was funded by a federal grant that ended in 2011, I think. So Tri-City Partners is now going to be the group that is the SHIP implementing group. So they aren't going to specifically focus on alcohol, tobacco, and other drugs at this point because they don't have funding for that.
Which I think creates a bigger gap, right? So
Yes.
I think we'll have to
Yep.
take a little bit closer look at this issue and figure out how we can first identify this or raise this issue up to an even greater importance, and two, figure out perhaps ways to coordinate resources. And Member Stegner may have some discussion at that point.
Matt had asked me to attend the Chemical Partners Group, which is basically made up of representatives from Edina organizations that are focused on teen drinking, smoking, and drug use. And also, I think they bring bullying to it as well. They're very well aware about what has happened with Tri-City Partners, and they're basically discussing kind of their own future. They've been more of a discussion group, and I think they're talking about, well, is it time to act and try to make more impact on these indicators? That hasn't been decided yet, but that's kind of what they're going to be talking about over the next couple of months. So it dovetails very nicely with what we are talking about here.
Any other comment? All right, thank you. So then the next subgroup report I'd like to hear from is the senior subgroup. I think Member Pence again is going to speak.
So the youth subgroup has a really nice data set in the sense that they have longitudinal data that self-report and captures every student in the district. The data we have for the seniors is not quite as cohesive and complete. Most of the data that we have related to the health of the seniors in Edina comes from the SHAPE survey, which is done by Hennepin County Public Health. The last one they did was in 2010. It's a self-report, it's a telephone survey, but even the way that they break out the data, Edina gets lumped in with the cities of Eden Prairie in some parts at Bloomington, Richfield, and Fort Snelling. That's how it happens. And so it's hard to know how true the data is to our region. What we do know from census data is that the average age of residents in Edina is 45.2 years, which is actually 8 years higher than the rest of the state. So Edina as a city is generally an older city than the rest of the state. About 21% of our residents are over the age of 62. So we have a lot of seniors living here, but we don't have great data as to what their needs are. But what we have seen from various data sources, including SHAPE, including the Minnesota Department of Health data, is that one of the biggest gaps I think we've seen is just a lack of social connections. It's a very common issue. We found, the SHAPE data found that almost more than a third of residents in 2010 identified that they are limited in some way by either physical, mental, or emotional illness of some sort, so they're not getting out in the community. And so I think there's an opportunity to really work on that, because what we know about health is that if the social connection piece isn't there, a lot of times the physical health consequences start to pile up as well. We heard from our Bloomington public health folks that there's a significant public health nursing program that happens, home visiting nursing program that happens, and I think there's a real opportunity to partner with them to find out, are there ways to connect with some of the folks that they are seeing to try to connect them to more resources. We have the Edina Senior Center. The connection with SHIP isn't quite as good, just because SHIP is so focused on essentially reducing obesity, and that is actually not a significant issue with the senior population in Edina. Our obesity and overweight levels are much lower than the state and county levels. So it really is that social connection, just the fact that part of aging is that it's harder to get around. And so I think part of the active transportation piece could work into that, but I really do think the main gap that we'll end up looking at is going to be kind of how do we keep seniors socially connected, especially if they lose their mobility.
Is there any additional comment or questions? Thank you. All right, now we'll move on to the general health subgroup. And so I know Member Stegner has some information he'd like to present, particularly related to quality of life survey and maybe one other issue.
Right. Let's set out a context. When we talked about general health, we were focused on the adult population 19 to 64, but many of the issues we're talking about also affect youth and seniors. One theme that came out was healthy eating and active lifestyles, and that's basically the combination of diet, nutrition, and exercise. A second focus that combined multiple factors was kind of behavioral health, which focused on, well, social isolation, addiction, and a broad range of other issues. And as you look at the first issue, diet and exercise, a lot of that relates to motivation. We all know that millions of dollars, billions of dollars are spent on diet, exercise, nutrition, but it isn't producing the results we want. So part of it is looking at what is motivating people and getting a better understanding of what leverage points we have where we can affect these things. It isn't for the lack of information. There's plenty of information on all these things out here, but it's very difficult for consumers to sort through it and figure out if something's good or bad for them, because often they'll see conflicting advice. So one thing that Matt mentioned was that Edina does a resident quality of life survey every 2 years. One was completed in 2013. A similar survey was completed in 2011 and supported the conclusions Matt's made about people thinking that health in the community is good. Was not an issue throughout the survey that came up. But there was kind of a broader issue related to that suggests that we may have some work to do. In the 2011 survey, people were asked, Edina quality of life, excellent, good, only fair, or poor. Well, it was basically broken between excellence and goods, with very few of the others. 90% excellent, 8% good in 2011. 2013, the excellent number had fallen to 73%. The good had increased from 8 to 26%, which is a pretty big increase. I'd call it significant. So if you want to look at where the issues are, where's that coming from? And actually, the city and the market research company produced crosstabs that look at different attitudes between different groups. And as you looked at the groups that had the lowest excellent scores, they were people age 18 to 44, the younger respondents, renters, apartment dwellers. They split the non-white population into Asians / Pacific and other. Those were both lower. And those who shop outside of Edina. All those factors relate to community connections. So to the degree that people have community connections, they feel that there's a higher quality of life. And if they're not connected, then they're less socially engaged, they're probably less active, it probably impacts their diet, their exercise, everything else, their general mental health. So I think that the quality of life and the health care connect together pretty well. one thing that the survey revealed that was supportive to what we are doing is they added a question in 2013 which asked, how much of a role should the city place in health and wellness when making policy decisions? Which is pretty much exactly what we have been talking about. 20% said very significant, 49% said somewhat significant. In other words, 75, close to 75%, more than 2/3, support the city putting significant emphasis on community health issues. So I think that's a very reassuring finding. I would also say, as you look at the results, there are many questions that will help to inform us more about kind of the mindset of people in Edina and what factors are going to impact their kind of lifestyle decisions in the future. Obviously, it didn't touch on everything that we'd want to look at. We have, I guess, some data collection goals for that in the future that are part of our work plan, but it does suggest that not only is there room for improvement, but there appears to be a pretty clear path that we can take to getting there.
Any additional comment on general health? Any questions? Good. That flows nicely into our 2014 work plan, and that is not yet, as far as I know, been approved. I just briefly was going to tie in a few things that were discussed here tonight that fit within that work plan. And so in the new initiative categories, what we're proposing are a few things. One is working with the Edina Resource Center and Bloomington Public Health, which already provides great service to the city, but on increasing focus and awareness on the resources that are actually available through Bloomington Public Health and other state, county, and local organizations. I think it's this committee's feeling that there's a portion of the population or residents in the city of Edina that have no idea that Bloomington Public Health actually serves the people and residents of the city. And so there'll be many ways that we're going to look to promote that and move that forward, one of which will be increasing website, discussing with the city, and a proposal here for another initiative for increasing website promotion of those services. Links to Bloomington Public Health or identification of Bloomington Public Health as a source of health services. We've discussed that with Bloomington Public Health already about, being able to, capable of handling the increased perhaps demand for those services, and they believe it's well within their capability to do that. Additionally, increasing focus and awareness with Bloomington Public Health and the Edina Resource Center on common mental health issues and available resources, which may and does tie into things such as social connectedness. Increasing awareness of healthy eating and living choices for more at-risk populations, lower income populations, could be seniors as well. Senior mobility and access to use of local and state and county services, which was a discussed item. So those are the kind of areas where we think that working with the Edina Resource Center and Bloomington Public Health can have an impact. Another area of focus will be working with Bloomington Public Health and the city to improve local health surveys to facilitate better Edina health benchmarking. While we believe we have some data points, one of the issues on the SHAPE survey is, again, it's grouped together, and there's different socioeconomic factors that go with each community that can't really translate from community to community when you look at the demographics and data. And so getting more specific information that's helpful to the city of Edina to benchmark, I think, will be a role we hope to help drive or play in 2014. We also look at each of the youth, senior, and general health subgroups, identifying 2 health improvement opportunities, and work with city staff on potential relevant policy changes. I think one of the ones we may take up is this electronic cigarette issue in that bucket of opportunity, as I will call it. And I talked about this item already, but again, initiating with city staff, increased community health presence on the city website and other media outlets, which may include the About Town. So those are some of the initiatives that we've proposed. I suspect we will get a couple more added by the city council, which is fine. And we'll take those on. But is there any further comment on that particular, on the work plan and how it ties into the items we talked about tonight? Any other thoughts? Because it's not finalized, and I can arguably add something that people think's missing. Just to mention real quickly, there is some coordination effort related to those issues on alcohol, drug, and tobacco use and bullying that we talked about as well.
I think I would just like to call out, and this is in relation to the work plan and then also with the survey, that it's important to consider that we do have changing demographics within our city, and especially with the youth and adolescents. So while I think the items that you've called out with the work plan are great, we need to make sure that we're being a little more open-minded perhaps in how we outreach to the community and and to really understand how the community wants to interact, so that we're really making sure that we're capturing everyone and not just the ways in which we've outreached historically. It might not be adequate for the populations that we have now.
Correct. This is a discussion I think we've had too with the Edina Resource Center in the past, which is that there's a changing demographic. With the changing demographic, they might have cultural differences. Right. There's a different way or more effective techniques for outreach, and so that's duly noted as an item to focus on. Any other comments? So that will end Section 5 and move on to Section 6, which is chair and committee member comments. My only comment is I guess we didn't really have a discussion of having a final meeting for the year. I actually think this should be our final meeting for the year, with the plan of receiving the input on the report and recommendation, with having the time with the city council on the 17th. I think that will be sufficient to close out the year, and then move into 2014 with hopefully our approved work plan and accomplish more in the coming year. Is there any other comment on that?
I have a comment. I think we've had a good year. We met much more frequently than was originally planned, and we've done a lot more work and shown perhaps more results. And I think this has been an excellent summary of what we've accomplished during the year. So I would agree with Matt.
And I want to thank everyone for their input and time and energy that was put into making this work this year. It's a lot of help to me when everybody's working towards improving the health of the city and providing that input and energy and time. So I appreciate that. Is there any other committee member comments? Hearing none, I'll move to Section 7, which is staff comments, and Item A, review of the 2014 meeting schedule and attendance requirements.
The 2014 meeting schedule has increased to 12 meetings. I know we discussed this before. This will include one televised meeting. I will be sending out an electronic copy of the schedule and the attendance requirements following this meeting here. I also have a printed copy if anyone would like to take one as they depart. So far we have the 11 meetings scheduled, but the televised meeting has yet to be scheduled. So we'll have some say in what date that will be. For item B, the Health Department staffing update, Jeff Brown and I have been working with Human Resources on a hiring plan to fill his former position as an environmental health specialist, and we expect to have that position posted this week and hopefully filled in mid to late January. That's it.
Any questions for staff?
Just a comment, well, I think we also have a annual meeting with the city council sometime during the year. Is that correct?
There'll be a meeting to discuss
Our
our
work
work plan at some point during the year.
Yes, that has not been scheduled yet, however. So we just have the regular meetings that have been scheduled already. We received that from Deb Mangan.
I guess I'd suggest that since we have a pretty well worked out work plan already, that earlier in the year would be better if possible.
Okay, thanks. If there are no other staff comments, view of the weather, I'm sure some people would like to make their easy way home. Is there a motion to adjourn the meeting?
Move to adjourn.
Is there a second?
Second.
So, motion to adjourn by Member Stegner and second by Member Hurley. All those in favor, say aye.
Aye.
Anybody opposed, which I've never heard, actually? No? Okay, the motion passes. Thank you.